We're going to move now to the BRAIN program. To learn more about the BRAIN program, Laura Haase joined the Children's Services Council of Martin County in January of 2009, where she develops and administers the council's operations and planning components, including the community needs assessment, the development and implementation of the organization's strategic plan, development of the funding priorities, oversight of the request for proposal, invitation to negotiate process, and the community advisory panel. She serves as an information resource to the council staff and the community for the program development, implementation, and management. Sheryl Paul has worked at Helping People Succeed for 28 years now in a variety of roles where she has been able to pursue her passion for babies and more specifically early childhood development from birth to 3. For 18 years, Sheryl coordinated home visits across Martin County to families who had 2-month-old babies through the Building Readiness Among Infants Now or BRAIN program. Most recently, Sheryl spends her time facilitating and training frontline staff and parents to spread the knowledge of the importance of language and the direct connection it has to literacy. Laura Haase and Sheryl Paul, welcome to you both.
Thank you. Thank you, everybody. And I'm really excited to talk to you today about the BRAIN program, which, as you can see, is an acronym for Building Readiness Among Infants Now. This program has been in Martin County for 22 years. And one of the things that's so wonderful about this program is that it is a universal outreach program, meaning that all Martin County families with newborns are eligible to receive this service. So at the core of the program, once a woman and her newborn are discharged from the hospital, they're eligible to receive a visit from a registered nurse about 3 days after they've been discharged, where they do a physical assessment of both the baby and the mom. About 8 weeks later, they're eligible to receive a brain development information session from an infant resource specialist from Helping People Succeed. And then the families are eligible to receive follow-up developmental monitoring for up to 4 years of life. So next slide, please. Just a little bit of history about the program. In 1987, there was a significant change that was made from insurance companies that once a mom delivered her baby, they now had to discharge within 24 hours. The nurses at Martin Memorial, which is now the Cleveland Clinic, the nurses at Martin Memorial were very concerned about this and concerned about the safety of both mom and baby. So they actually succeeded in getting the hospital administration to approve mother-baby home visits after 3 days. That program went on for a number of years, and in 1997, a group of community leaders from the Martin County Healthy Start Coalition, the Martin Memorial Hospital, and Helping People Succeed attended a statewide conference on the importance of brain development and how critical the first 1,000 days are in an infant's life. They came back to the community committed to getting this information out to as many people as they possibly could. They brainstormed, quote unquote, brainstormed an idea on how to get this information out to everybody. And with that, they derived a plan and submitted an application to Children's Services Council. And in 1998, the BRAIN program was officially born. So we're very excited about that program. As you can see, the program's been in existence through Children's Services Council for 22 years. It has served more than 18,000 families over the course of that time. One of the unique things, or one of the exciting things about this program, is that there were babies born back in 1998, infants back in 1998, who are now moms receiving the same service. And that's just an incredible, circle of life. Next slide, please. As I said in the beginning, the eligibility is for all Martin County residents with newborns. Initially, the plan was that they were going to look at high-risk moms and high-risk pregnancies, but they realized that this program information was so critical to get out to everybody. CSC put actually in the dollars so that it would serve everybody in the county. There's about 1,000 families per year that receive the home visits. Our county has a birth rate of about 1,200. And for those moms that deliver within Cleveland Clinic, the acceptance rate is about 98%, 98, 99%. The challenge that we face is when families deliver to neighboring counties and neighboring hospitals, they don't always know of the program. So that's one of our strategic plans, is to work with the neighboring counties and neighboring communities to make families aware of this. Next slide, please. As I said in the beginning, the first part of the program is for a registered nurse to come visit the family within 3 days, within 3 to 4 days after discharge, and do both a physical assessment of both the mom and baby. Examples of what's learned during this time is they look at the vitals, they make sure that the heartbeat is okay. They look at the mom, do a physical assessment. They have, during these visits, if a concern pops up during these visits, they're able to refer to their physician. There have been a few extreme cases over the years where in one instance, for instance, a heart murmur was detected in the baby, and the baby was in open heart surgery within 12 hours and saved the baby's life. So this is a critical program. Again, all families are eligible for this, at least a minimum of this one visit, but if there's any concern, then the nurses can come back in about 8 to 10 days and do another assessment. In addition to the physical assessment of mom and baby, the nurses also do, they assess the home for home safety, fire safety, pool safety, just to make sure it's a safe environment. They check to see that they have a support system in place. If the baby is breastfeeding, they are able to determine if there's any challenges with breastfeeding, and they can make referrals to the lactation consultant. So it's a very thorough, intense visit. And at the end of the visit, what they do is they introduce the next portion of it with the brain development and helping people succeed. So they've introduced the idea that they'll be receiving a phone call within the next few weeks with somebody from Helping People Succeed to set up a brain visit. And then I'm going to turn this over to Sheryl because that's her piece. So thank you.
Good morning, everyone. So I'm going to primarily speak to you about what we do on that 2-month home visit that we are Helping People Succeed are lucky enough to be able to provide. Next slide, please. So as Laura explained to you, the primary goals of that nursing visit has to do with infant care, physical and nutritional needs. And our 2-month home visit, the goal is to increase understanding of early brain development, infant development, and parent-child interaction. So how do we do that? Well, I would tell you the main thing that we do is we tell parents that they're already doing all of the incredible things that they need to be doing. They just don't know how important it is. So we bring a binder filled with great information that's all scientifically based, but easy to read. Some is very visually attractive, and we really explain how all the things that they're doing in those first years of life are helping their baby make connections in the brain, helping them to feel safe in the world, which therefore will help them learn later on in life. And it really is a big, huge sigh of relief for those of you who are parents, grandparents, caregivers, to just know that somebody's saying to you, you're doing everything that your baby needs. And here's why all the things that you do are so incredibly important. So we bring that, and we also, in the bag that we bring, we call it our swag bag, we bring a book and we bring a toy to help give parents the tools to help interact with their babies. At the time of that visit, we also do we offer them a developmental monitoring system that we start doing when their baby turns 4 months of age. We use the Ages and Stages questionnaire, which is a questionnaire that was developed specifically for parental reporting. And we use their online system mostly. We also do have a mail out system. And what that does is they fill that out online. It gets mailed back to the online system. And then we get to read all of those results. And so for every single parent that responds, we are looking at that child's results and we are seeing what is going on with that baby. Next slide, please. So as you can see from this slide, we spoke with over 1,500 families in our last fiscal year, 2019 to 2020. That is incredible. And what I think that says to parents, and what I love to say to parents when I was doing visits was, lucky for us, we have a Children's Services Council, and what that does is it funds programs like this, which help you feel embraced by your community. You are not alone. There are tons of resources, and we are there to help connect you with that and help you know that your baby is doing everything that your baby should be doing. And if they're not, we can help you with that. We can make referrals for you. We can talk to you about ideas of how to promote those developmental milestones. And we are just a plethora in our community of services to help you know that you are not alone in this journey. So we are very proud of that. As you can see, you know, developmental concerns, over 300 families had concerns about their baby, or that was found on those ASQs. So we are very proud of that system and very proud that we are able to keep contact with those families until the child is 4 years old if they wish. Next slide, please. So as you can see, we do parent surveys to report their gain in knowledge, and 100% of parents report that they gain knowledge both on that nursing visit and on our 2-month home visit, which is phenomenal. 80% are still breastfeeding at 6 months, which we really attribute to that nursing visit. And 30% of our families have received a second visit from the nurse if something is going on, as Laura had mentioned to you. Next slide, please. We have so many partners in our community. That is something that is very wonderful. Just like Teresa said about St. Lucie County, your community comes together. We're all in it together. I would make a plug for early intervention. You know, we can avoid prevention. We can avoid intervention if we have prevention programs. And I really see the BRAIN program as a prevention program. We are helping parents start their children out with all the tools that they could possibly need. And we are proud to have many partners in our community. So in a nutshell, that's our program. I have so much to say, as does Laura. We're proud of the BRAIN program. We love it. As you can tell, I've been doing it for many, many years, and I'm still as passionate about it now as I was 20 plus years ago. So please reach out to us if we can help you in any way. Thanks.